Hey, good afternoon, everybody. I hope you're all having a wonderful springtime. It's another beautiful day out. Feels like spring is here finally, and I think summer's just around the corner. So hopefully you all are going to have a great summer and you have some fun summer plans. So this is the next in our series of virtual town halls. The last one was in February. We're doing these every 3 months or so. So we're on schedule and happy to talk with you today. So I'm going to quickly review the agenda for you, and then we'll get into it. So we are going to talk about some of the staff changes and promotions that have been recently announced, but I just want to be sure everybody hears about them. So we're going to go over those one more time. Then Rita was going to do the financials, but she's working on the budget furiously, our brand new July 1 budget. So I'm going to do the financial report. And as part of that financial report, I'm going to talk about Medicare Advantage, which I'm sure is on everybody's minds. And after that, I am going to hand it over to Dr. Arif, who is going to talk about the brand new 3-year strategic plan that we are in the process of developing. Because as you know, we do 3-year planning cycles. The current 3-year cycle that we are in comes to an end on June 30th. So we're working with our board of directors and all of our providers, stakeholders to come up with a new plan. So Kerm's going to talk to you about that. And then I'll come back on and just talk about some miscellaneous announcements. So with that, let's just get started. So there's a lot of organizational changes that are going to happen as part of our brand new budget on July 1. Almost all of these, there's one that hasn't been announced maybe, so you're going to hear about one new thing, but the rest of these people changes and position changes have all been previously announced. So first of all, we announced some time ago that we're going to split my current position, which is president and CEO, into 2 separate positions. It's not uncommon for organizations to do that. And so effective July 1, Dr. RF will serve as the president of Western Health Advantage, and I will serve as chief executive officer. So Khurram will report to me as CEO, and then the senior team, the chiefs, will begin reporting directly to Khurram as president on July 1. So with that move, it kind of set some dominoes into movement here. And again, this announcement went out, I think, about a week ago, maybe a little bit more, that I'm pleased to announce again for the second time that Dr. Khan, who currently serves as our medical director, effective July 1, is going to step into the chief medical officer role, which was one of the roles that Dr. Arif previously held. And just like Dr. Arif, when he was chief medical officer, Dr. Khan is going to lead the medical management department, corporate quality, and utilization management operations, effective July 1. Also on July 1, we've established a new position called Chief Pharmacy Officer. And again, I'm pleased to announce again that Dr. Beering has been appointed to that position. That is a senior staff position. And that is important because pharmacy is an ever bigger part of our medical costs. So Dr. Beering is going to focus on pharmacy cost management, pharmacy quality, pharmacy strategy, and also we're going to build out a new pharmacy services unit to help answer members' questions and provider questions about pharmacy. So congratulations to Dr. Khan and Dr. Beering on those two positions. We also are moving some of the puzzle pieces around, and the Claims and Provider Relations Department, which currently report to Khurram, is now going to report to the Chief Financial Officer. So Saeed Hamdani, who has reported to the CFO once before, will now report back to Rita as CFO. Human Resources Department, which has been reporting to the Chief Financial Officer, is going to report directly to the President. So Becky, as head of HR, is going to be reporting to Khurram as President. The position, Khurram held two positions, a Chief Medical Officer and Chief Operating Officer. The COO position is one that we established about a year and a half ago or so. So that position is going to be retired, and we are not going to have a Chief Operating Officer. Now, you also all know, hopefully know, that our longtime Chief Legal Officer, Rebecca Downing, is retiring the first week of July after being with us for many, 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 many years. I can't remember the exact number of years, so I'm not going to try to guess, but has it been 17 years? I'm sorry, Rebecca, if it's not.
It'll be 19 years. It would be 19 years on July 18th, but you know,
okay,
who counts?
So I wasn't far off. 19 years, and when she retires. So we conducted a search for a new Chief Legal Officer, and this has not been announced yet. We've chosen Wendy So as our brand new Chief Legal Officer. It's actually Wendy So McKeeman, and I'm not sure whether Wendy goes normally by Wendy So or Wendy So McKeeman, but for now we'll call her Wendy So. She's going to be joining us in early June, sometime I believe the first week of June, to become our Chief Legal Officer. Wendy has an array of experience in healthcare and especially regarding legal affairs in healthcare. She's coming to us from Carleon Behavioral Health. She's also worked for a law firm in town, DePonde Simpson Rowe, which is a law firm that we use a lot for regulatory matters. So Wendy worked for them for a number of years. Wendy also worked, and this is where I met Wendy, at the California Association of Health Plans for 5 years, where she held a number of positions, including her last position there was the Vice President of State Programs. And for those of you that don't know, the California Association of Health Plans, I'm on their board. It is the trade group, the trade association, to which almost all health plans in California belong. It's kind of our advocacy lobbying group. And also in her spare time, Wendy also is an adjunct professor at University of the Pacific, McGeorge School of Law. So we're very happy to have Wendy join us the first week of June as a new addition to senior staff. Also, I think you all know that Rita, our CFO, is retiring December 31st of this year. So we are going to be starting a search for a new Chief Financial Officer, probably in early summer, I would guess. And we hope to have a new CFO on board by late November or early December, so that there can be a little bit of overlap, just like Wendy is starting in early June. So there'll be about a month overlap with Rebecca. So all of those pieces are moving around. And I know you've heard about all of that except for Wendy So. So I just wanted to reiterate it since we've got a lot of people on the call here today. All right, with that, I'm going to move into the financial report. And the financial report is through, sorry about that. The financial report is through March 31st of this calendar year. So that's 9 months of our budget year. Our last budget year this year is going to be June. So through those 9 months, we're tracking ahead of budget. Our commercial business, which means our large group, small group, individual business, CalPERS business, etc., everything other than MA really, has a net income through March 31st. I'm going around here of a little over $3.8 million, which is wonderful. And our enrollment through March 31st is, and I'm reading this out of the budget package, is 120,189 lives. That's across total enrollment, commercial and MA, which is actually almost 8,000 lives better than budget. Our budget says we're going to have about 112,000 lives. So that's a great membership report. Of those 120,000 lives, I'm going to round again, 116,000 lives are commercial lives, and the balance are Medicare Advantage. So we had a really good year, as you heard last time from Jeff, I believe, in Covered California enrollment and CalPERS enrollment. So that's all good news. Now, that's on the commercial side. On the Medicare side, and then I'm going to get into the announcement of us exiting from Medicare. On the Medicare side, we've had losses through March 31st of $3.9 million. So we made $3.8 million on commercial. We've lost, around it, and we've lost little under 3.9 million on Medicare. So if you combine all of that, overall, we have a loss through March 31st of $41,000. That's still better than budget, because according to the budget, we had budgeted for a loss of $463,000. So even though it's a combined loss, we're still doing better than budget. So that brings me to the announcement we made through our management team that we are going to exit the Medicare Advantage product at the end of this calendar year. Medicare runs on a calendar year basis, as you probably know. So that was a decision that was not pleasant to make. It was difficult to make. We've been in Medicare Advantage since 2021. So this is 2024 is our 4th year in Medicare. And every year Medicare has run a deficit or a loss. We've been waiting for those losses to reduce as our membership grows, but that hasn't happened for a number of reasons. And so that, coupled with the fact that our providers, who are the same providers that provide medical care to our commercial members, are not having good experience with our MA population. Not to get into the weeds with you, but we capitate our providers on a full risk basis for all of our products, our group products, our individual products, and our Medicare Advantage product. And what full risk means is that we pay them a per member per month fee, and they provide basically all of the medical care with a relatively few exceptions for our members. So we are the only health plan that puts our providers at risk for Medicare. They have other Medicare business through other health plans, such as Blue Shield, for example, and Health Net and others. But those health plans do not put them under full risk. So they are having difficulty managing the Medicare population under full risk capitation, because the Western health population is the only one that they're under full risk for. So we came to a joint conclusion with our providers that because the plan operationally at the plan level, us, continues to lose money, and our providers continued to lose money, that it just wasn't sustainable to stay in the business. We had our actuaries, Millman, do a forecast through 2026, and their forecast showed that our losses were not getting any better. So the difficult decision was made to exit the Medicare business. We talked about it with our board of directors, 2-3 weeks ago, and they approved the decision. So we are exiting again on December 31st. I know we've got a great team that works on Medicare. There's a team that's dedicated to Medicare. There's a lot of us that spend bits and pieces of our time on Medicare. And so there's a lot of people that are affected by that. We're working with those people to determine what the termination of Medicare business means for them. We're going to be able to hopefully find places for some of those folks. And if we can't, then the HR department has put together a package that we're going to offer, just as we had to do a layoff many, many years ago. And we're going to use the same separation package that we used way back those many years ago. So again, this was a difficult decision. The business is with us through December 31st. So no one's job is affected until the end of this calendar year. So we've got time to plan for this. And that really is why we are getting out of the Medicare business, because it has been such a difficult financial proposition for both Western Health Advantage as the plan and our providers. And again, it was a difficult decision even for our providers. So that's the rationale behind that. And now I am going to turn it over to Khurram. So Khurram, if you can turn your camera on, and I think maybe Rick is helping him with a slide or two. Khurram is going to lead us through our draft strategic plan, which would run July 1 of this year through June 30th of 2027. And I say draft plan because the board hasn't approved this yet. We have another board meeting the last week of June, and this will be on the agenda for their approval. So with that, Khurram, I'll hand it over to you.
Thank you, Gary. Hi, folks. Good afternoon. Welcome to our town hall for May. So let's talk a little bit about our 3-year plan, what went into it. What I have here is a single slide just highlighting the drivers that we identified as the drivers we'd like to focus on for the next 3 years. So the process of creating the 3-year plan evolves every time we do this. And this time what we did is we had a retreat with our managers and directors and the senior staff about 2 months or so ago. And we obtained a lot of ideas from our collective team on where should the company focus on and what should our strategy be and where should the focus be for the next 3 years. And the one big thing that we heard from everybody was we need to do a lot of improvement and with respect to our operations. And I guess what that means is that the work that we do right now for our members, the core work as a health plan, we do it well, but there are lots of opportunities there to optimize that work. And so we titled this plan, the strategic plan for foundational excellence, based on that feedback. And the word foundational is key. We know we have excellent people doing work across the company, working really hard. And the foundation, the core of what we do, we want to redouble the focus on that core so that when the members join us, they get an absolutely A-level experience as a member with a health plan. So the few drivers here, I'm just going to talk about them for a few minutes. The first one is creative access. Access, as you know, is a broad term, and it basically encompasses the ability of members to get care when they need care. And we know there's a national shortage of physicians, and the word creative speaks to the fact that while we as a health plan do not directly hire providers, as you know, we do offer a lot of programs and ways to access care, which may not necessarily always require a physician's an appointment with a doctor per se. And I'm talking about the various disease management programs that we have. We also have been working hard with all of our medical groups to redesign the way that they schedule appointments, create all kinds of other support, such as, virtual teams to help onboard members and those kinds of services to basically improve access. And so that's where the word creative access comes into this. The second driver is driver is disciplined growth. And disciplined growth is all about going after lines of business that make sense for us to expand into, and that will give us a, financially will make sense and also just sort of grow the overall business, but to do that in a disciplined fashion. And in certain regions, obviously, as you know, we've got, 2 large regions where we have services within Sacramento and then outside of Sacramento, working with those healthcare providers in those regions to decide what rate makes sense for which employer, et cetera. And so that's what disciplined growth really encompasses. Healthcare quality and cost, no surprise there, right? We know that we live in a world of constantly escalating costs, including healthcare. And so what can we as a plan do to manage those costs? Be smart about, where the costs are moving to within the market, and how do we position ourselves? As an example, just as an example that illustrates the point, talking about the Ozempics and the whole focus on obesity medications, and how do we adjust to the demand in the market and make the right decisions so that we can provide the appropriate coverage, but also manage our costs. And then the quality piece, all the various programs that we have, how well are they performing for our members? What do they cost us, and what's the clinical outcomes that we get in those programs? This also includes things like all the hard work that goes into risk adjustment, all the work into our HEDIS submissions every year so we can maintain and improve our NCQA accreditation, as well as the work, the prior authorizations. How do we streamline that work so we remove the burden that may be involved in prior authorizations, and we avoid unnecessary denials? The member experience piece, as you know, is key, and really looking at new ideas around member experience. I'm very happy to as an example, we're looking at the whole digital, a member's digital experience and redesigning that, not just talking about the website per se, but everything that goes behind the scenes, so that the member's digital experience is smooth, efficient, and at the next level from what we have right now. This includes things like helping with member onboarding and all the various pieces that go into that. The next strategy is pharmacy services, and as Gary was mentioning, Dr. Byring is moving into the Chief Pharmacy Officer role with a real focus on coming up with, designing better and newer pharmacy services, such as hand-holding the members and providers if they need that kind of help, as well as managing our pharmacy costs by looking at new and innovative programs in that space. And then finally, core operations. This is basically all the work that we do across the company, across the various departments. How do we improve that level of work? Where do we find the opportunities that are sitting out there? How do we get the departments working and coordinating and planning ahead in terms of where the opportunities are to work better, and all the different pieces that go into core operations? So that's the overall strategic plan for the next 3 years. And over this next month or so, you will see that your chiefs and your directors and managers will be engaging with you on the different tactics, the various steps that will go into making each of these drivers a success over the next 3 years. And with that, I will conclude. Thank you, Gary. I'll pass it back to you.
Okay, hey, great. Thank you, Khurram. So we're excited about the new 3-year plan. It's all about continuing to grow Western Health Advantage and to do a better job for our members and our providers. So we've been already discussed this potential plan with our board 3 weeks ago. Khurram and I are going out and meeting with provider groups such as Mercy Medical Group, Hill Physicians Medical Group, to review this proposed plan. And then again, we hope that on at our board meeting the last week of June that the board will approve it. So I think, as Kerm said, under those drivers, there's a whole bunch of individual strategies and a whole bunch of tactics. So as always, in these town halls, once it's approved, we will be reporting to you on what we're doing under that strategic plan, which we've done at every one of these town halls that we've had. So so that's the plan for the future. All right, and just one announcement that I was asked to make, and that is that we have a wonderful financial services resource which is available to all of our employees. A fellow by the name of Al Roach, who a lot of you know, he is the individual whose company helps us monitor and run our 401k plan, regularly offers seminars and educational meetings on a whole bunch of topics. It can be retirement planning. It can be on budgeting. What's the best way to put together a budget for my house, my home, my family? Money management. What are some tips for managing personal money? And so we used to email out invitations to these educational seminars whenever one was going to be scheduled. Well, we stopped doing that because the invitations are now on IWA. So participation in these meetings has really fallen off because people haven't been going on IWA and looking at what is being offered. So I encourage all of you to use IWA. Remember, that's our new platform where we do a lot of things through IWA, including internal communications. So if you go out and look on IWA, you'll see a calendar where Al is doing these seminars. It gives the subject matter of the seminar, the date, etc. So I encourage you to go out and look at that menu of options that are being offered. And if you have any interest in any of these seminars, please sign up. They're very educational, and it's a free service. And Al does this for us, but he's a financial planner out there in the public. So normally folks have to pay to go to these seminars. So these are at no cost to our employees. And there are, maybe 5 or 6 of them throughout the year, maybe at least 1 or 2 a quarter. So please go out and check IWA. All right. And other than that, Rick, are there any questions that have gone into chat?
There are not. We did get one, remember, a couple days ago through the form online, but nothing in the meeting today.
Yeah, and what we've done with that one, we've been in touch with the individual and we're handling that directly. So yeah, so with that, boy, half an hour sure goes fast. It's now been a little more than 30 minutes. Again, thank you all for participating. The message I leave you with is our commercial business is going strong. We're looking forward to a great budget year in July 1. We're looking forward to a great 3 years under our brand new strategic plan. And as I said, you'll be hearing a lot about that at our next town hall, which will be sometime in August, probably is 90 days out. And we'll talk more about it then. With that, thank you and have a good rest of your day. Appreciate it. Bye-bye.